Hi, Joe.
Hi, Beth.
How are you?
I'm good, good. How are you? Nice to see you.
I'm nice to see you as well. I um I have some questions for you.
Sure, shoot.
So I've been getting a lot of we've been getting a lot of emails because you have a very exciting course coming up, and that is your 30-hour myofunctional therapy course. And it starts on October the
Well, we start on the 12th. I'm very much looking forward to it. So not too long, only a couple weeks.
yeah, a couple of weeks and it gets started. And we've just had so much interest and so many questions that I thought I would just take this opportunity to ask you a couple of questions and answer some of the emails we're getting.
Okay, no problem.
So, just from your experience as a myofunctional therapist, could you, in a couple sentences, just sort of tell me what is the best part? Like, what is it about that gets you so excited? Every time I talk to you about it, I can just tell how passionate you are about this topic.
It's a big question to answer, but it's honestly, the I would say the very best thing about it is the constant and consistent learning about myofunctional therapy and the changes that are happening within the community of airway centric dentistry or airway centric orthodontics. And I would have the other side of it is the change that you can really make in somebody's world. Um, Kids that are chronic mouth breathers that just don't know, and parents don't know, and helping parents find solutions to the problems that their kids have had forever, or helping the parents find the solutions to the problems that they've had forever. And just being connected to a community that's available um, to your patients. It's great. People, we as hygienists don't really think about it, but we're often the most frequent healthcare provider that a patient sees. And so we have
Good
such an
point.
opportunity, right, to learn and to change people's lives from a health perspective. So that's probably one of the best things that I love about it, is because it really opens up people's eyes to what could be and how things can be better, but in a pretty simple way. So,
Right. Right.
yeah.
Well, I'm excited. I know as I've gotten to know you and heard some of the stories of the change you're talking about, right? Different clients that you've had where a real change that's really, I'm not trying to be dramatic, but it's changed their life,
Yeah.
right? And you've been there with them, you've walked that with them, and just the opportunities. It's something different than maybe what we learned when we were in dental hygiene school.
Absolutely. I mean,
Yeah.
it's stuff that we all are aware of, but we just don't. We have our busy lives and our busy schedules and our full days, and we don't. It's unless we really learn it and understand it, we don't. It's not something that we recognize as easily that we think we would.
Yeah.
Yeah, it's cool. I love it. It's fun.
I can tell you love it. And I think it's really exciting just that you've put this course together and that you can offer it to other dental hygienists who kind of want to know more and start to do some of these things as well. So one of the questions that we're getting from some of our members is, are you saying that, after this course, so after this 30-hour course with you, are they going to become myofunctional therapists who can do some of these exciting things as well with their clients?
Absolutely. That's the whole reason that we're doing this, is so that we can, as registered dental hygienists, we can own a part of myofunctional therapy on the sort of global stage, and we can take it directly back to practice and start implementing it right away. And as we talked about, this is really just the beginning of most of the students learning, but the ability to go through this program of 30 hours and to be able to go right back to practice and essentially start a program right away and be the myofunctional therapist in your practice is not only does it add value to the practice, it adds value to the patients, right, or clients. So that's the best part about it. But absolutely, I plan to make sure that each student that attends this course walks out of there as a myofunctional therapist.
That's very exciting. It's really exciting.
Yeah.
And I know how much of an undertaking this was and how much of yourself you put in. So I'm so excited for everyone who's going to be able to be part of this. But if you had to, again, boil it down and acknowledge sort of what you've done, what is it that you're most excited about for what you've created here?
I'm probably most excited about building the community of registered dental hygienists that are myofunctional therapists in Canada. And really, but on a small scale and a personal scale, and having it, it's one of the reasons we've kept the group so small, and there's only a couple spots left, I think, for the next round, the initial round, is to really make sure that people understand, the hygienists, the ones that are going to be those myofunctional therapists and become part of the community, that they really own what they're doing and trust what they're doing and start to build the community here in Canada. But on a really qualitative scale, I guess is that the right word? Just to really own it, essentially. One of the reasons I kept it limited to just a number of students was to teach this on a larger scale to 50 students. There's less quality assurance, I'll say, from my perspective. So you can really hone in on the quality assurance, and you can take that time with a smaller class group. So that's what I'm excited about. I'm excited about the one-to-one with the class, with the group that I have, because anybody that's taking the course is there because they want to learn it. It's an investment, and it's an investment in their own personal practice. So it's that's the best thing. That's the most thing I'm most excited about, is that I'm going to be speaking to people who want to learn it, and they're going to be part of the community now that we sort of that the select few of us here in Canada are trying to build.
Yeah, no, very well said. I'm excited for that part of it. You know, small group, getting really kind of that really dedicated attention from you. You guys are going to get to know each other very well. You know, 30 hours together as a group. You guys are going to be a tight-knit group by the end, and I think that's really wonderful.
It's going to be it'll be fun, because we're gonna I mean, the group's going to teach me things, I'm sure, and but we're going to learn a lot about each other, and that's the fun part about this stuff. And as you start to learn it, you realize you see this stuff in yourself, the things that myofunctional disorders, you start to see it in yourself, and you start to see it in your family and your kids, and the prospect of who you can help just becomes much, much bigger. And it's pretty exciting, especially working with a small group, and you work through, because we're going to have a group of people that are going to have myofunctional disorders, and we're going to help, even in the little group, we're going to help solve those problems. It's the revelation of understanding what real oral rest posture is really fun, even when you fascinating. But it's going to be a fun group for sure.
Yeah. Well, thank you so much for taking this time. I think it's going to be a great course. Anybody who has registered already, anyone who's thinking about it, you're in for a treat. I'm excited. I can't wait to hear how it all goes. And so, yeah, thank you so much for putting this together. And thanks for taking this time.
Anytime. I'm excited too, and I can't wait.
Yeah, me too. Well, have a good day, Joe. Thank you so much.
Thanks, you too.